Hello, welcome to Nottingham Trent University. This is the Brackenhurst campus. I'm Suzanne and I'm one of the Assistant Co-ordinators of the Veterinary Nursing Centre. The centre itself was opened in 2008 by the Earl of Wessex and is set to depict a working veterinary practice. So the students come on campus for 3 years and they learn the foundation degree in veterinary nursing. They then have the option afterwards to come back and do a BS Honours top-up degree course once they've completed their FDSC certificate training. So if you'd like to follow me, I'm going to show you the first teaching room. So we've got mannequins on the table. We've got it set out for 5 different groups of students. Some of the mannequins, as you can see, have got intravenous lines in, some have got nasogastric tubes, just purely to simulate what an actual vein or venipuncture is like for the student. The students will be learning how to calculate and administer intravenous drugs in this room. The drugs that we use are purely water. We use injection vials, but they are filled with tap water. So we're now coming to the X-ray room or the radiography room. We've got 3 simulators in total. Now this one here is fixed. The other 2 are mobile, so we can move them into the teaching rooms if necessary, so the students can work in small groups. The mannequins that we use for X-rays are slightly different to the ones that we use for the other medical procedures, in that these have got anatomically correct skeletons within them. So for positioning, students need to know where the anatomical landmarks are. These mannequins have them all, so when they're lying them on an X-ray plate, they can feel for where they need to centre their beam. So this is the second of our practical teaching rooms. This is more set up to depict a working surgical theatre. So we've got the surgical scrub sink where students are taught how to do a full surgical scrub. Obviously scrubbing for theatre is very, very different to washing your hands in a normal situation. We've got a full range of surgical instruments as well as orthopaedic. It's vital that veterinary nurses know the difference between these instruments and know how each one is used. We've also got the anaesthetic machines as well. Now the anaesthetic machines that we use here in the practical demonstrations are not actual functioning machines, apart from the fact that they have oxygen running to them, which is completely harmless. So the students are taught different ways of setting up the anaesthetic machines, checking for any leaks or any damage in those, as well as different circuits that will be used in different sorts of animals and different sizes. We've also got the surgical drapes, we've got the gowns, we've got the gloves, we've got dressings. A very important part of veterinary nursing is bandaging and dressings. We've also got the autoclaves that are fully functionable, fully serviced and ready for use. Now the reason we have these is not purely for teaching, it is when we have any surgical procedures that take place. Now every now and then on the animal unit there may be an animal that needs a surgical procedure. All of the staff here are registered veterinary nurses or registered vets, so any procedure that needs to be carried out can be done in here, where it changes from being a pretend theatre to being a real one, and it is treated in an aseptic manner. So we now come into one of the animal handling rooms. In here we teach medical nursing, as you've already seen set up previously. So we can have the mannequins on the tables, and we teach the medical nursing modules in here, such as applying a dressing, chest drains and urinary catheters. We've also got the vast array of anatomical specimens that you can see here, most of which are preserved, but a lot of them are plastic to-scale models. These are invaluable for when we're teaching our students anatomy, physiology and dissection. We've also got behind me the equine skeleton and a hippo skull. So this is another one of our animal handling rooms. So this room is used for quite a few different functions, animal handling being one of them, but as you can see it's actually set up now for a laboratory technique. So the students in this room will be asked to make their own blood smear. They will then be staining the blood smear and then they will be looking at it under the microscope. So animal handling also happens in here. Now this is where the fun begins. So our first year students come in and they are presented with a handful of dogs that generally run around together. They listen to the dog's heart, they feel their pulse and they do a full nose to tail examination. So they do dogs, cats and ferrets all in here. All of the animals that are used for animal handling are behaviourally assessed and none of them are aggressive. So this brings us to the final room of our tour. Now this room is actually situated in the animal unit rather than the veterinary nursing centre, but we are lucky that we can have free access of all of the animals and the rooms in here. So as you can see here, I have Ruth the guinea pig. We also have the rabbits in here, which are species that we teach our veterinary nurses how to handle. We also have the exotics, the reptiles, the poultry and the goats, to name but a few. And with any of these less familiar species, we're very lucky that we have the animal technicians on hand to help us with this. So I hope I've answered all questions that you may have, and we hope to see you soon.